Senate Special Committee on Aging is grateful to welcome all of our witnesses today. Today's hearing is about direct care workers who provide invaluable long-term care to so many of our loved ones all across the country. Our conversation today is particularly timely given that President Biden recently issued a proclamation declaring this month, the month of April, Care Workers Recognition Month. It wouldn't be a bad idea to do that every month. Long-term care is intended to provide supports and services to help people live independently and as safely as possible. These services can be provided in various settings, including residential facilities like nursing homes or in our own homes. Whenever they are provided, the backbone of these services are, of course, the professionals who provide these services. These individuals, these Americans, are irreplaceable. They're essential. And they're often called to work in this field because they love what they do. We wouldn't have long-term care services without the long-term care workforce. Unfortunately, the workforce that provides this critical care has long been in crisis. Between 50 to over 90% of long-term care settings and providers report significant staffing shortages, affecting their ability to provide services, accept new clients, or even to remain open. As we'll hear from some of our witnesses today, so many factors contribute to high turnover and difficulty recruiting a long-term care workforce that can meet the needs of older adults, people with disabilities, and their families. We will not have quality long-term care when turnover rates for the direct care workforce are 40 to 60%. In 2022, the median wage for direct care workers was just above $15 an hour. Just above $15 an hour. Well below what it was paid for warehouse and convenience store jobs. The direct care workforce, the majority of whom are women of color, are more likely to live in poverty compared to the general public. Many direct care professionals have to work multiple jobs or overtime in order to be able to support themselves and their families. And the jobs often offer few or no benefits, including no paid leave or sick leave. Here's the bottom line. If we claim that their work as caregivers is essential, we should accord them the status of a professional. Numerous studies indicate that insufficient staffing is directly correlated with lower quality of care, worse health outcomes for people receiving long-term care, and increased burdens on family caregivers. Insufficient staffing and high turnover rates also mean longer hours, more strenuous workloads, increased rates of burnout, further straining the long-term care workforce. It's time to make the smart choice for families and communities and strengthen our long-term care workforce. That's why I'm proud to introduce the Long-Term Care Workforce Support Act. Senator Kaine, who joins us today, is with me on that bill, and Senator Baldwin as well, along with 23 of our colleagues. This comprehensive bill will make a generational investment in the workforce that will help us care for our loved ones who need support. This investment is about supporting and empowering the direct care workforce. Specifically, the bill will first provide pathways to enter and be supported in the workforce. Second, improve compensation. Third, ensure that the workforce is treated with respect and is provided a safe working environment. Fourth, the bill will provide opportunities to learn from effective recruitment and training strategies that promote retention. By professionalizing and supporting the long-term care workforce, we can better recruit and retain the professionals we need in this vital field. This investment is critical, especially when recognizing that our aging population is growing exponentially, and many older adults are living with chronic conditions and disabilities. As a nation, we must do better for all care workers. And so I look forward to hearing from our witnesses today who do this essential work every day in their own work, advocating for better policies, and who are witnesses that can help us guide our path forward. I'll next turn to Ranking Member Braun for his opening statement.
Thank you, Chairman Casey, and thank you to all the witnesses coming here today. The Aging Committee, been on it since I've been in the Senate, and really gets to the crux of a lot of issues out there that other committees don't do. We can't technically legislate through it, but we've had more interesting hearings here that are applicable to everyone's lives, even though it's aging. A lot of times it even rolls down to where it impacts younger people. We're all going to be there someday. By 2030, adults will outnumber children for the first time in our country's history. We're experiencing a shortage of long-term care workers and expected to get worse. Proud of the fact that Indiana, a very entrepreneurial state, has been on the leading edge of this issue for a long time. Strata Education Foundation, based in Indianapolis, is transforming education by partnering with educators, policymakers, employers to increase opportunities through work-based learning. We need innovation at the state and local levels to meet this increased demand. We don't need really a lot more from the federal government, in my opinion, simply because it's doing a lot. It's borrowing a lot of it from our future generations to do it. In the laboratory of 50 different states where you got to live within your means, I think might be a better way to approach it. In September, the Biden administration proposed staffing minimums for nursing homes, which would impact all long-term care providers, making a mandate. Well, 80% of them may have trouble getting to that staffing level as a mandate, may be forced to close their doors. I think that'd be counterproductive. Today, we hear many other proposals for cumbersome federal regulations, requirements, and protections. And again, maybe we ought to look to an approach that's going to have more impact, be more effective. Giving more power to the federal government usually means spending more money, almost all of which we borrow. We don't actually have it here to do. These solutions, and sometimes, are very partisan in nature as well. I think that, again, emphasize what has worked and where we can afford it, and where you can be more entrepreneurial may be the best way to go about it. When it comes to protecting healthcare workforce through OSHA, you're pushing for duplicative requirements that have huge costs in many cases. I introduced the Voluntary Protection Program with Senator Bennett, which allows OSHA to work alongside employers and workers to encourage businesses to adopt stringent safety and health standards for their employees. VPP, which it's called, have shown injury and illness rates 50% lower than industry averages where it's been implemented. And that is where you're working in a voluntary basis with the employers that are going to have to make the difference, saving $257 million. To grow the long-term care workforce, the federal government should make it easier for people to enter by removing barriers. Senator Kaine and I introduced the Jobs Act, which allows federal Pell Grants to be used for high-quality, short-term job training, including long-term care. Senators Rosens, Collins, and I introduced the Train More Nurses Act, which passed the Senate in January. This bill reviews all nursing grant programs to find ways to increase nursing pathways. Senator Klobuchar and I introduced the Skills Investment Act and the Freedom to Invest in Tomorrow's Workforce Act, which expand Coverdell and 529 education savings accounts so Americans can use their funds for training and credentialing. These bills address the needs for our workforce and our growing aging population in a bipartisan way without steep costs associated with them. We ought to focus on productive approaches to build and grow the care profession. Look forward to hearing today about state innovations, workforce challenges, and thoughtful solutions to an issue that definitely needs our attention. I yield back.
Thank you, Ranking Member Braun. for your opening statement. Before we introduce today's witnesses, I'd like to turn to my colleague, Senator Kaine from Virginia. Senator Kaine has been a long-time champion for long-term care and the professionals who provide this care. Throughout our time in the Senate, Senator Kaine and I have worked together to address long-term care issues and to ensure individuals and their families have access to essential long-term care services. And I'm proud to have him as a partner on this new legislation, the Long-Term Care Workforce Support Act. Senator Kaine?
Thank you, Chair Casey and Ranking Member Braun. It's a treat to be able to come back to the Aging Committee. I used to be on the committee a number of years back. I'm no longer on the committee, but I wanted to come today just to thank those of you who are witnesses, those of you here in the room who care so passionately about this, and to thank the Chairman and Ranking Member for holding this hearing today. I can't think of a better reason to be here than to talk about the important issues of our long-term care workforce. As I travel around Virginia, and I know this is the same with my colleagues traveling around Indiana and Pennsylvania, I hear from health systems, independent providers, long-term care facilities, so many more about the challenges recruiting, training, and retaining a high-quality healthcare workforce. But I also hear directly from family members, from seniors, people with disabilities, and caregivers about the difficulty they experience finding reliable quality help and the gratitude that they feel when they do find that help. I have a family story, just like everyone in this room has a family story. My sister-in-law Taylor, my wife's sister, was diagnosed with Alzheimer's early onset when she was 56 years old. That was now 12 years ago. And watching her husband, John, just one of the saints of the world, deal with that situation, and my wife going up about every other month to upstate New York where she lives to be a part-time caretaker to give John a break, but also this in-home healthcare provider, Darlene, who has been a steady presence in their life. When you see that and it works, and for so many it doesn't work, but when you see that and it works, you understand that the quality of workforce is just directly tied to our happiness and our health and our kind of measurement of our success as a society. These challenges are getting tougher. It's getting tougher for people to find and afford. It's getting tougher for providers to be able to provide healthcare and make a living doing it. It's getting hard for institutions to find and retain the quality workforce, as Senator Braun said. And that's why it's been an honor to work with Senator Casey, Senator Baldwin, and now 23 members on the introduction of a new bill, the Long-Term Care Workforce Support Act. Aging is something we all have in common. And we have it in common not only when we're older, but we have it in common with relatives and friends. We all want to be able to live in a place where we are not only able to maneuver, but those of different ages or different abilities who are our friends and family should be able to come and visit and feel safe and feel like they can make it work. And so all of us are going to need supportive services at some point in our life, whether in a home or in a long-term care facility. The bill we've introduced today will do that. Addressing gaps in the long-term healthcare workforce should be top of mind for Congress, and I'm hoping that today's hearing will further the conversation. Each of you have important perspectives to bring to the table. You will further the conversation about how we can support this really important part of our nation's workforce. So again, to the chair and ranking, thank you for holding the important hearing. I'm in the middle of competing armed services and foreign relations hearings, and after the witnesses are introduced, I'll need to duck to those, but I do appreciate that I could come in and just share a few minutes with you, and I'll yield back to you, Chairman Casey.
Senator Kaine, thanks so much. We're honored you're here today. I'll move now to our witnesses. Our first witness is Mr. Nicholas Smith from Philadelphia, Pennsylvania. He is a direct support professional and behavioral health specialist lead at SPIN, a nonprofit organization that provides services to people with intellectual, developmental, and autism spectrum disabilities. Mr. Smith has been in this field for over 25 years. Thank you, Mr. Smith, for being with us today and for sharing your experiences with the committee. I'll now turn to Ranking Member Braun to introduce both our second and our third witnesses.
My pleasure to introduce Brooke Vogelman. Brooke is a licensed practical nurse with 15 years of experience in long-term care. She received her Certified Nursing Assistant certification in 2009 from Ivy Tech Community College, which I think turns out more certificates like that than any other institution in the country. Proud of having a place like that in Indiana. She has worked with TLC Management as a regional clinical education coordinator, where she teaches and inspires the next generation of workforce. She recently began a new journey working towards her registered nursing degree with full support from her current employer. Thank you for testifying here today. Next witness is Matt Connell, is the Vice President of Healthcare at Ivy Tech Community College. Referenced that a little bit ago, where he has led the School of Nursing to become one of the largest in the country. Dr. Connell has been in the health and education spheres for over 18 years, both at Ivy Tech and as a physical therapist in long-term care. He serves on numerous local, state, and national committees that focus on growing the healthcare workforce. Thank you for testifying here today. I yield back.
Thank you, Senator Braun. Our fourth witness is Dr. Jasmine Travers, from New York, New York. Dr. Travers is an assistant professor at New York University Rory Myers College of Nursing and is an adult gerontological nurse practitioner. Her research is focused on improving health outcomes in vulnerable older adult populations. Her current work focuses on mitigating disparities in access and use of long-term care for older adults. Thank you, Dr. Travers, for being with us and for sharing your expertise and your experience with the committee. So we'll start with Mr. Smith for his opening statement, and then we'll continue with the other opening statements. Mr. Smith, you may begin.
Chairman Casey, Ranking Member Braun, and members of the Senate Committee, thank you for inviting me to testify today. My name is Nicholas Smith. I'm honored to be here. I was asked to talk about the immeasurable value and critical role of direct support professionals supporting people with intellectual disabilities, autism, to live meaningful lives. I am a direct support professional, or DSP, at SPIN, an organization that provides services for over 3,000 people with intellectual disabilities and autism in Pennsylvania. I have been in the field for over 25 years, with SPIN for over 17 years. My testimony will focus on my experience as a DSP. I attended Penn State University, and when I finished, I went into a quality control senior lead position in manufacturing. However, the job did not feel fulfilling, and I felt like it wasn't living up to my full potential. Later, I worked for an organization providing support to kids and teens, which I fell in love with supporting people, and I knew this is what I wanted to do. When the organization closed, I moved back to Philadelphia and got connected with SPIN. I was offered a management position in residential services, but turned it down because I thought I would apply for the DSP position. The rest is history. As a direct support professional, I support ever-changing physical, emotional, personal, communication, and recreational needs of individuals. In my years as a DSP, I have administered medications, assisted individuals to gain and maintain physical abilities like walking, grasping, hand-eye coordination, taught new skills to increase independence, including instructions, assertive technology, public transportation, and former natural supports, provided transportations, monitoring and support physical and emotional well-being, and ensure dietary needs of each person met by grocery shopping, preparing food based on their dietary directions, and teaching cooking skills, just to name a few. I am proud to be there both during milestone times, people's lives and achievements, and challenging times like illness and death. One of my most memorable experiences when one of the young men I support got his first job at a local deli. He couldn't believe it. He had been turned down by so many businesses before. When this happened, we would spend time talking about staying positive and continue to move forward. I was able to help him with more opportunities and submit his resume to assure him that in his frustration, he would find success. In my role, I am required to meet an extensive requirements and demands to be a DSP related to training, documentation, and job accountabilities. I also attend and participate in several regular meetings, which are important because DSPs are a support system, direct line of communication to families and their needs. I've also voluntarily enrolled in SPIN's first cohort of the National Alliance for Direct Support Professionals, eBadge Academy Credentialing Program. I have achieved my credential as the DSP-1, which has involved over 50 hours of accredited education, well as gathering 11 experience testimonials. I'm currently working on my DSP-2. I chose to pursue the credential because it gives me and other direct support professionals the ability to show we are fully competent, proficient, and highly qualified in providing lifelong care. and highlights the fact that we have the knowledge, training, and skill set to do all these things. I am thankful to have great supports, but I still have challenges. I work nearly 65 to 70 hours a week. I am a single father, and due to my work, I have missed family events, vacations, nieces and nephews' recitals, and school functions. The trade-off is that I'm able to make more money to provide for my family. Even when my daughter asks, "Dad, will you be off on Sunday?" I have to answer her no, and I have to work more to make more. I do my best on the 1 day off a week, Mondays the whole time just for her. I love my job. I have been blessed to work at Spin where I can grow and make a difference, but it's a struggle to stay because I don't make a livable wage. A lot of people are leaving this field to make more money. Other industries are offering more money while people want to stay in this field, they cannot make ends meet. What keeps me up at night? Working and making sure that I can afford, maintain, and support my family. When I work just 40 hours, I see my check and I worry, do I have enough? My daughter is currently looking at colleges, and her top focus is at Penn State. Penn State will require a lot of money even when she gets scholarships. However, I need to be mindful of working too much so I don't risk the people that I'm supporting or myself. It takes a lot of energy to be a DSP, and you're required to always be on your A game. This job is getting tougher as I get older. I am not the 30-year-old Nick anymore. I am 47, and it feels the effects of time intensifying what the role requires. In closing, I want to emphasize how important it is to recognize and prioritize direct support professionals as valued professionals who deserve the right to earn a living wage for themselves and their family. I want to thank you for your time and support for DSPs and people with intellectual disabilities. Thank you.
Mr. Smith, thanks very much, and thanks for getting us started. Ms. Vogelman, you may begin.
Thank you, Chairman Casey, Ranking Member Braun, and all of the members of the Aging Committee for this opportunity. It is an honor to share with you some of my experiences in healthcare. My name is Brooke Vogelman, and I am a mother and a licensed practical nurse, and I have spent my entire 15-year career working in long-term care. I have always known that I wanted to be a nurse and that I would devote my life to helping others. Fortunately, I did have an incredible team around me who supported my journey. In high school, Ann Alexander, whom we called Mrs. A, was an incredible mentor and teacher. She was a former registered nurse who helped me become a certified nursing assistant. In addition to my family, she instilled in me the confidence and knowledge to succeed in my studies. During my first clinical rotation, we were assigned to care for a specific resident. The assignment sounded easy enough. Get to know your resident by learning their past and what their interests are, as well as their current clinical needs. It was during this exercise that I fell in love with long-term care. I wanted to get to know my patients and build relationships with them and ultimately support them during their later stages of life. So directly after high school, I saved my graduation money and obtained my CNA certification through Ivy Tech Community College in Fort Wayne, Indiana. I then started working in a local long-term care facility. And after 4 years, I wanted to advance my career. I received a fully paid scholarship for my practical nursing degree through my employer at the time, American Senior Communities. And as a licensed practical nurse, I have taken on several roles, including an infection preventionist, unit manager, assistant director of nursing, as well as the staff development coordinator. Eventually, I became a CNA instructor, and for the last 2 years, I've been working with TLC Management as the regional clinical education coordinator, where I continue to teach tomorrow's healthcare force in Fort Wayne, Indiana. I am committed to illuminating the pathway for future nurses like Miss A did for me so many years ago. And I am also working towards obtaining my RN degree, thanks again to a full scholarship from my current employer, TLC Management. I have seen the commitment from long-term care profession to support practitioners like myself. I have also seen practitioners come and go for a myriad of reasons. Some have moved on to other healthcare settings, while some have left healthcare altogether. I have also seen what happens when long-term care facilities lack the workers and the resources, as well as government support, like during the pandemic. Many of my colleagues got burned out and left the profession, which forced facilities to rely on costly temporary staffing agencies. The long-term care workforce is still struggling to recover to pre-pandemic levels. I've never experienced anybody who doesn't want more help in our facilities, but there's simply a lack of interested or qualified candidates to meet our increasing demand for our aging population. I am hopeful that federal policymakers, including the members of this committee, will help us address this challenge through targeted investments and not blanket mandates. I do believe it is critical to focus on quality over quantity. For instance, LPNs are an integral to the interdisciplinary team in long-term care. Staffing mandates that do not include our contributions to patient care or recognize us as nurses is very concerning to me and will have unintended negative consequences on our residents. Additionally, staffing mandates will force our facilities to depend more on expensive staffing agencies, and personally, I am concerned that they will actually increase staff burnout, as current caregivers will be stretched thin and working even longer hours in order to comply with these impossible standards. If facilities still cannot find the workers needed, which is very likely since we are facing a caregiver shortage, more facilities will be forced to limit the access to care or even close their doors completely. Staffing should be about training and education as well as retention. We need workforce development programs that help us grow our care force, incentivize our caregivers to choose a career in long-term care, and invest in their career development. As a single mom, I am working full-time, still trying to advance in my career, and I am very grateful to have received the support that I have. Working in long-term care is more than just a job. It is a calling, and our residents become like our family. And we need more people to seek out this rewarding profession, which I am committed to help grow. I do want to thank you for your time, and I look forward to answering your questions today.
Ms. Vogelman, thanks very much for your testimony. Dr. Connell, you may begin.
Chairman Casey, Ranking Member Braun, and members of the committee, thank you for this opportunity to appear before you today and represent Ivy Tech Community College of Indiana and share the work that we're doing in the state to address the healthcare workforce shortage, including those impacting long-term care. I'll provide background on Ivy Tech and our leadership in producing long-term care professionals in the state, share how our innovative programs, specifically our Healthcare Academy and Achieve Your Degree programs, have enabled us to respond to the state's healthcare workforce shortage, and discuss how state flexibility has enabled Ivy Tech's abilities to educate and produce members of the healthcare workforce. Ivy Tech Community College is Indiana's largest post-secondary institution, serving over 190,000 students across our 19 campuses, 26 satellite locations, and online. Nearly half of these students, almost 92,000, are pursuing college credit while in high school. Our system size enables us to address the state's most urgent workforce needs. Ivy Tech is the nation's largest singly accredited statewide community college system, its leading provider of dual credit, and the largest producer of associate degree nurses. In Indiana, 1 in 3 registered nurses is an Ivy Tech alum, and over 90% of our healthcare graduates remain in the state and work in Indiana hospitals and healthcare settings. Ivy Tech offers many programs focusing on educating and developing graduates who can enter the field and support long-term care workforce demands. Programming includes traditional academic associate degrees such as nursing and physical therapist assistant, various long-term healthcare-focused technical certificates such as practical nursing and healthcare clinical support specialist, and short-term academic and skills training certificates such as CNA, home health aide, dementia care aide, and others, designed to help graduates enter the workforce quickly and provide critical services for our long-term care populations, all of this at the lowest tuition rates in the state. These are a sample of the industry-aligned healthcare programming offered at Ivy Tech to meet the evolving needs of the communities that we serve. In Indiana, like many regions across the nation, we've witnessed a convergence of factors contributing to a critical shortage in healthcare workers. This perfect storm continues to affect multiple career fields within healthcare, and addressing the crisis requires a multifaceted approach and innovative solutions to make the healthcare sector more resilient and sustainable. Thanks to a generous grant from United Healthcare, the college is in its second year of such program called Ivy Tech Healthcare Academy. The academy provides summer programming for rising 9th through 12th graders, and the students participate in 8 weeks of intensive healthcare-focused career exploration, including pathways in the long-term care sector. Participants will complete 4.5 credits of academic coursework that can transfer into various Ivy Tech healthcare programs and multiple skills training courses focused on competencies required for entry-level direct care and long-term care roles. To date, more than 200 high school students have enrolled in this program. Ivy Tech also offers a program called Achieve Your Degree, or AYD, through which the college is removing barriers to upskilling for nearly 300 Indiana employers, including over 200 in the healthcare sector. The program allows AYD partners and their employees to earn approved associate degrees and credentials with minimal or no upfront cost. Employees will pay for courses after completing classes using their employer's tuition reimbursement benefit. Traditionally, higher education requires payment upon enrollment, but Achieve Your Degree adopts a model of earn, learn, and return, which provides greater access for participants to skill up and move into higher wage roles. Through partnerships with organizations like the Indiana Healthcare Association and the Indiana Hospital Association, Ivy Tech has collaborated with leaders in the Indiana General Assembly to enhance flexibility in the healthcare program delivery. Legislation such as House Enrolled Act 1003, Nursing Indiana Back to Health, which passed in 2022, has enabled Ivy Tech to expand our nursing program by removing limits on how fast we can grow enrollment totals, increasing our ability to incorporate simulation hours, and enhancing our ability to hire more part-time faculty. This local control approach affords opportunities to customize our work to meet the needs of the communities we serve by increasing our nursing program capacity by 766 seats through spring of 2024. And it also elevated our program quality, as in 2023, our graduates exceeded 90% on the NCLEX RN exam and over 97% on the NCLEX PN exam. Ivy Tech is actively seeking further legislative partnership to address additional healthcare workforce needs. Ivy Tech also acknowledges the importance of work for adult learners and is collaborating with stakeholders to establish educational pathways like healthcare apprenticeships. These innovative ways will allow students to sustain themselves and their families financially while pursuing high-quality healthcare credentials. Through partnerships with employers, we're developing registered and non-registered apprenticeship programs that will provide on-the-job training and enable students to progress in healthcare careers and earn competitive wages. I thank you again for this opportunity to appear before the committee and share the work that Ivy Tech is doing with the college. I applaud and appreciate your leadership and service to the country.
Dr. Connell, thanks very much. We'll turn next to Dr. Travers.
Chairman Casey, Ranking Member Braun, and members of the Senate Committee on Aging, thank you for inviting me to testify today. I began my career as a certified nursing assistant in a nursing home, and now I am honored to sit before you as a PhD nurse working to improve the issues I witnessed decades ago. The long-term care system relies on a workforce that is often unseen and unheard, known as direct care workers. These 4.8 million personal care aides, home health aides, and nursing assistants enter the home of your parents, grandparents, friends, and neighbors. They are the people who care for your relatives and friends in nursing and residential communities. They bathe your grandma and feed your dad with dementia. Without these critical workers, who would care for your loved ones? Would it be you? Despite the critical role of the direct care workforce, it faces significant challenges in recruitment, retention, and morale that threaten its sustainability. In the next decade, the long-term care sector will need to fill 9.3 million jobs, but the supply of direct care workers is shrinking relative to demand, especially in nursing homes serving a high proportion of Black residents and in deprived neighborhoods. Turnover among direct care workers is 46% across long-term care settings, and this workforce continually reports that their job is physically taxing, emotionally draining, and stressful. The issues affecting this workforce are multidimensional and are compounded by an external environment that devalues their work. Put simply, it is a job behind the job, or the underlying realities that make direct care work unsustainable. These realities include poor wages and limited benefits, a blind eye to inequities, chronic undervaluation, mistreatment in a demanding work environment, and insufficient training, preparation, and growth opportunities. Addressing these challenges requires a multi-pronged approach involving federal and state governments, aging organizations, payers, providers, advocates, care recipients, and direct care workers themselves. First, we must invest financially. Implementing minimum wage floors, wage pass-throughs, or incentive payment programs must be considered. Benefit packages should include childcare, transportation, paid leave, sick pay, and rural pay differentials. In addition to increased financial support for long-term care, states should allocate a percentage of Medicaid payments to staffing. Next, we must provide robust training and development opportunities. Providers, states, and federal government must invest in comprehensive and accessible training that equips direct care workers with the skills to manage complex resident needs. This includes sufficient hours, relevant topics, and experiential training. Regarding accessibility, as CNA noted, I was going to get my CNA license before I moved out of state, but why pay around $1,500 to get certified when I can get into Burger King without an interview making more money? Additionally, clear pathways for career advancement within the role and into other healthcare professions are essential to foster a sense of growth and expand the contributions of this workforce. Third, we must foster a positive work environment through culture change. Direct care workers report that a pervasive lack of respect is more detrimental than low pay. Leaders must be held accountable for creating positive work environments that are free of abuse and disrespect. As one direct care worker shared, if a cashier was punched, the customer would without a doubt be arrested. But you can punch, spit on, kick, or bite a healthcare worker with no punishment. Additionally, payers and state and federal governments must incentivize providers to integrate direct care workers into care teams and to center their voices. With regards to alleviating workloads, the federal government must ensure that the most thoughtful version of the proposed minimum nursing home staffing standards is enacted immediately. Next, we must focus on retention in addition to recruitment. There must be a focus on making long-term care settings desirable places to work. A direct care worker noted, "I feel like if management were required to work alongside nurses and CNAs in long-term care for 1 day a week, so many things would change." Importantly, because direct care workers often come from historically marginalized groups, support for them should seek to address systemic social and equity challenges that prevent them from entering or remaining in the field. Providers must be equipped to challenge and respond to bias, harassment, and discrimination. Moreover, reforming immigration policies to support direct care workers is necessary to increase their supply. Additionally, support for direct recruitment and retention efforts such as recognition programs, sign-on bonuses, retention specialists, and investigations of high turnover must be provided with the recognition of the role agency plays in recruitment. Long-term care settings should also leverage community partners to assist with recruitment. Fourth, we must plan to evaluate and disseminate. It is necessary for states, providers, and the federal government to regularly collect data on workplace satisfaction, demographics, and workforce capacity to better understand staffing challenges and evaluate the effects of interventions. As a next step, we must identify and share successful strategies to facilitate positive change throughout. Lastly, I want to put the policies, data, and stories together so that we can better understand the consequences of inadequate staffing to our older adults, one of which is long waits, as an example. A nursing home resident shared, "When you put on your call light and there's only one aide on the floor, you can wait 20 to 25 minutes before you see someone. You can be putting the light on because you dropped a pen on the floor or because you're experiencing a heart attack. They all get the same wait time." I urge this committee to prioritize the recruitment and retention of the long-term care direct care workforce so that we don't fall prey to losing a loved one or our own lives as a result of inadequate staffing. Thank you.
Dr. Travers, thanks very much for your testimony. We want to thank all of our witnesses. We'll go out of order for our first set of questions. Everyone is juggling hearings on a busy Tuesday, so I'll start with Senator Blumenthal.
Thank you, Mr. Chairman. Really appreciate the chairman and ranking member for having this hearing. The work that our healthcare and other long-term care workforce does is really critical to Connecticut and to our whole country, and maybe not the most glamorous topic in the world, but still deeply significant to all of us. And I'm grateful to all of you for being here today. Wages are often at the very top of mind when we discuss long-term care professionals. A recent report found that 43% of direct care workers rely on public assistance, such as Medicaid or the Supplemental Nutrition Assistance Program, SNAP, in Connecticut. In 2021, 42% of direct care workers lacked affordable housing. That is a searing indictment of the present system. We know that increased wages is not only better for those workers, but it also attracts a better quality workforce. And the demand for direct care workers exists, but it is critical that we provide them with a living wage. And that's why I'm excited to see a tentative agreement in Connecticut that would provide $23 an hour, $23 per hour for home health care aides and bonuses, time off, and improved access to health insurance. Let me ask Dr. Travers, can you speak to how increased wages enable these professionals to better access other benefits like health insurance, child care, and other supports?
Thank you for that question, Senator Blumenthal, and excited to see all the work that is coming out of Connecticut. As was mentioned before by Nicholas Smith earlier, just thinking about the amount of hours that direct care workers must work as a result of inaccessible livable wages. Reform like that would allow for direct care workers to be able to not have to work 60 to 70 hours per week. When thinking about that, they will have more access to family time, to leisure activities, to things like exercise that will improve their health and healthy outcomes, and will allow for them to be able to provide better care with less stress and burden to the people that they are serving on a day-to-day basis. So something like that would most definitely improve the life and well-being of direct care workers.
Anybody with familiarity about the work that is done by long-term care workers knows that they have highly demanding jobs, emotionally and physically. And those jobs can be draining. Many who enter this profession are not fully aware of the parameters of the job because there is a lack of readily accessible information about what it means to be a long-term healthcare worker. There are no federal training requirements for categories of home care workers, such as personal care aides. There have been efforts at the federal level through the Direct Service Workforce Competency Project to research and develop a set of core competencies. How can the federal government, Dr. Travers, continue to support standardizing this kind of recruitment and training? Does the federal government have a role in providing uniform standards to this profession?
Could you just repeat the question as far as the recruitment piece?
Well, there are currently ways for people to get into this profession. They're recruited to do it. States have individual standards and requirements, but there's no national standard. Do you think there should be?
I think that there needs to be improved access to enter this workforce. For me, I started as a certified nursing assistant, and I entered through a structured program that was delivered through high school. So more technical assistant programs that allow for individuals to be exposed to long-term care experiences in a structured manner is something that is necessary national-wide. So that is something that I most definitely would advocate for as far as the recruitment and entry. And then also with regards to just increasing our workforce, leveraging those who are of immigrant status, it would be significantly important as well. And just as I said in my testimony, just looking to reform immigration policies so that we can support more direct care workers who are already filling a significant proportion of these roles would be important.
Thank you. Thank you all. Thanks, Mr. Chairman, for giving me this opportunity to go first.
Thanks, Senator Blumenthal. We'll next turn to Senator Vance.
Thank you, Mr. Chair, and thanks to the ranking member and you for hosting the hearing, and thanks to the four of you for being here. I just wanted to focus a little bit on the difficulties that long-term care workers face to sort of better understand why we're having some of the labor shortage issues. So first, Ms. Vogelman, you've been in this industry for 15 years. And I guess maybe I'd sort of like to better understand what are sort of the biggest challenges you see yourself and some of your colleagues facing in engaging in this work?
I definitely think that some of the challenges, as I spoke about in my testimony, are that we do often work without quality of staff. Since the pandemic, when I think a lot of our colleagues have left the profession, we haven't really had the chance to recover yet. And I do think that we are seeing a growing amount coming into the profession. I do think that we should focus more resources on the training of those potential caregivers. I think that, and it's not necessarily the amount and numbers that gets us through the shift, it's the amount of the ability that the team has to work together and provide a strong team that is dedicated and compassionate and going to be readily there when needed. So I apologize.
Sure. No, that's good. And just to be clear, I mean, I'm sure that there's much that's challenging, but I imagine there's a lot that's rewarding too, right?
Absolutely. I do think our rewards go beyond monetary value. Building relationships with our residents. Again, they become like family. Sometimes we're the only faces that they see in a day. And so our time that we have to spend with them is just as equally important for the clinical as the emotional that we bring to them as well.
Great. Thank you for that. Dr. Connell, in your work training Americans to be the next generation of long-term care workers, what are some of your students' biggest trepidations? Or, what are they worried about going into this profession?
Thank you for the question, Senator. I think a lot of what we're trying to do is to find opportunities to create access for more folks that would like to enter the workforce. Through our programs like AYD, Healthcare Academy, it's creating the opportunities for folks that have an interest to be able to get that access. We also understand that a lot of our learners are adults who have financial concerns in addition to education concerns, and so creating opportunities for them to be able to earn and learn is very important for them. And we're working with employer partners to develop things like healthcare apprenticeships that would offer those opportunities for learners to be able to earn a living wage while they're learning, while they're moving forward to upskill into higher positions.
Sure. And can I just ask a question on the Biden administration's proposed federal staffing ratios for nursing homes? We obviously have a lot of nursing homes in the state of Ohio, a number in rural areas where I think the labor shortages are especially acute. Are you familiar with this staffing ratio proposal?
We are, as Ivy Tech, are still looking at that bill, so we haven't gone fully into it, but we'd love to connect with Senator Braun's team and look into that more.
Okay. My fear, of course, is that if you change the staffing ratios in an environment where a lot of these facilities are already labor constrained, you might actually lead to closures, right? So sort of understand and appreciate the desire to make sure that these facilities are properly staffed, but you don't want to propose a rule that creates more problems than it solves, and I do worry about what the Biden administration is doing there. So I would love to follow up there, but with that, I'll yield the remainder of my time, and thanks to all of you again.
Thank you, Senator Vance. I'll start my questions now, and I know we'll be having senators coming in and out as we typically do on a day like today. Senator Kelly was here earlier, and we'll await other senators arriving to attend and or ask questions. I wanted to start with Mr. Smith. I want to thank you for sharing your experiences and the work that you do to help so many people in our home state. I like the way you started your testimony. I underlined in the first couple lines of your testimony, you said that you were here today to recognize, quote, the immeasurable value and critical role of direct support professionals in the work that they do. So immeasurable value and critical role, a perfectly appropriate description of the work and the contribution of these workers. And it's clear to me that you take great pride in your work. You wouldn't be working all those hours if you didn't. And you also take, and I'm sure should be very proud of the opportunity to provide support in so many aspects of the lives of your clients. And I hear the same all across our state when I talk to these direct support professionals. As you noted in your testimony, it's very demanding work. You shared with us that you often work 60 to 70 hours a week, or 65 to 70 hours a week to make ends meet, and that unfortunately is not uncommon in the work done by so many of the professionals we're talking about. So here's my question, Mr. Smith. As you confront these challenges as we do as a nation, if we make it a priority to appropriately compensate individuals for this important work and ensure that you and other direct support professionals, or I should say direct care professionals, are paid a living wage, what would that mean for you and your family?
Thank you for the question, Senator Casey. For myself and for the colleagues and the people we support, having to appropriate and compensate would do a lot for me personally. I would have more time to be a father, a son, a brother, a friend. I spend a lot of time working, a lot of hours working. So, as you know, you miss out on a lot of different events, and, it comes with the territory. So, a 40-hour work week is not something that I really, it's not a norm in this field. So, average 65, 70, but, I do it with love, but to have a living wage would definitely, cut down some so I can, spend some time with my daughter, and I do get to see her, but, like I said, I'm at work majority of the time. Thank you.
I think we can all understand and relate to that. That's part of the human condition, being able to spend at least some time in the course of a week with family, and it's hard to do that if you're working 65 to 70 hours a week. Dr. Travers, long-term care has long been both undervalued and underinvested in. I think that's unfortunately an understatement that I just made. And this is due to a lot of factors, obviously. Direct care workers often share stories of being underappreciated, further exacerbating staffing shortages. As you made reference to, sometimes that's more important than their pay. The respect that is accorded to them or not, their work being recognized or not, their sense of the value of their own work being affirmed by those who employ them. This, what I would call underappreciation, also often manifests in the form of both low compensation and low or no benefits. As you testified, years of experience in direct care professions barely increase wages. And as we've heard today from Ms. Vogelman and Mr. Smith, it's critical that we make the necessary investments to foster both a respectful workplace as well as a supportive workplace for direct care workers. So Dr. Travers, how can we bring about the culture change that both empowers and professionalizes the long-term care workforce?
Thank you for that question. We have to recognize that leaders within these settings are responsible for creating this culture to begin with, because we cannot make these changes without changing what's going on in these settings. So making leaders accountable for culture change and recruitment and retention efforts. So that's going to require for us to possibly incentivize through value-based programs and such to make sure that quality and culture is part of these incentivization metrics. Another thing that we have to think about when thinking about this culture change is empowering the individuals through different roles that they're able to access, through career advancement opportunities, through pathways within the current role, as also within other healthcare professions. Some of the things that we talk about when it comes to the individual, the direct care worker, how are they integrated into the interdisciplinary care teams and the care plans of these individuals, which that has been a problem for many years, although CMS, specifically for nursing homes, has required that the direct care worker, the certified nursing assistant specifically, be a part of those teams. So there's challenges and barriers when it comes to integrating them as a part of those teams. So we need to change the culture within these settings and through long-term care to ensure that direct care workers are part of these teams, that their voices do matter, that they're included in decision-making, if not at the forefront of that decision-making as well.
Doctor, thanks very much. I'll turn next to Ranking Member Braun.
Thank you, Mr. Chairman. I'll start first with Dr. Connell. We're blessed in Indiana to have a place like Ivy Tech, being the biggest manufacturer per capita in the country. I think next to Wisconsin, we're always nip and tuck there, but we have got a broad need for better skills, better training. You train the largest number of nursing students of any institution in the country. That's impressive. I didn't know that until today. You built partnerships throughout the states to raise awareness about jobs in high demand and develop training programs, clinical experiences to meet that demand. What best practices would you want to highlight so that other states can know what's worked in Indiana?
Thank you for the question, Senator Braun. A lot of our work is being able to partner with our stakeholders around the state. As a singly accredited college system, we do have the luxury of working with institutions like Indiana Hospital Association, Indiana Healthcare Association, and our employer partners to understand the need in the specific service regions that we're working through, where our campuses are located. So again, being really thoughtful and mindful and intentional around making our decisions to meet those local needs has been very helpful in identifying where we need to think about programming, think about creating additional access opportunities, and then pairing those with the tools that students would need to be successful.
Last September, the Biden administration proposed staffing minimums for nursing homes. Today, we heard about other efforts to create national standards for long-term care workers for licensure, labor, protection, wages, and benefits. How have state and local controls contributed to the ability for you to train and educate more students? And is it necessary to have more federal involvement, or would that complicate things?
Thank you for that question. Again, I think working with our local stakeholders has been very beneficial and giving us an opportunity to understand the specific needs of the various service regions that we serve. What we'll see in Indianapolis is not what we'll see as a need in Terre Haute, and so being able to customize our approaches to meet those specific needs has been very helpful. I think generally we support the efforts to ensure that there's adequate supply of skilled long-term care workers to meet both community demand and enable high-quality education and skills training opportunities. But again, being able to work locally with our industry partners has been valuable.
One final question before I turn to Ms. Vogelman. And we have, through a bill introduced, Jobs Act, would allow students to use Pell Grants for high-quality, shorter-term job training programs. I'd like to get other methods here to where they'd have more flexibility. I'm guessing that expanding that would make your job easier. And how much of that have you realized from the federal government to this point, to where they give you more flexibility with funding here to apply towards your programs?
Thank you. We do support the bipartisan efforts to expand Pell eligibility and high-quality, short-skilled training. We think that would also help go a long way with healthcare and long-term care as well. We understand that working adults and students who currently enroll in short-term programs to upgrade their skills must pay out of pocket, and that's one of those access points and the pairing that with the tools required for success that we do believe could be a barrier for individuals and would support additional leniency there.
Thank you. Got a couple questions for Ms. Vogelman. You have shown us how opportunities for growth are crucial to the success of long-term care workforce because of your devotion, passion, desire to learn. Your employers have sponsored for you your LPN and your RN degrees. You want to elaborate on that a bit?
Thank you, Senator Braun. So yes, I have received full sponsors for my tuition, and along with covering my tuition, they've also helped with child care services while I was in education. I think, as you've mentioned, we are making great strides on bringing the workforce and the new talent within Indiana to the care force. I think the resources still needed are really going to be helping the existing staff, providing preceptorships, mentorships for the new staff, as well as that critical quality training right there in the beginning, and allowing them to advance within their careers and with the support of their employers as well.
I want to give a shout out to your employers and the fact that they oftentimes want the educational system just to automatically be there. I think there has to be an interaction between the two. And one final question. I was on our education committee for 1 year when I was in the State House. And I often thought that career and technical education, skills-based, just wasn't there in middle school through high school. How much is that important to where only about a third of all jobs out there need a 4-year degree? How much better can we do by talking about skills and training, apprenticeships, and everything that goes into probably the 2/3 of high school students that are going to go directly into the workforce? Do you think that's been given its due attention?
I definitely think that we could spend more attention trying to reach them at earlier in time so that they can really be introduced to the healthcare, because there are, as we spoke about, a lot of demands in healthcare that sometimes I feel even my students weren't prepared for once they actually get out into the field. So to introduce them earlier, and then give them those stepping stones to really building their career is definitely important. And I'm actually very interested in some of the things that Dr. Connell was talking about with the high school at the Ivy Tech level. I know TLC management, we actually try to do a lot with junior achievement in Indiana and trying to reach them a little bit earlier. And we also try to work with dual credits within colleges, and we're actually starting our first apprenticeship program for those students with school schedules and working around them and allowing them to come into the care force.
Thank you. I yield back.
Thank you, Senator Braun. We'll turn next to Senator Warren.
Thank you. Thank you, Chairman Casey, and thank you for holding this hearing and continuing to shine a spotlight on the long-term care workforce. The federal government plays a critical role in ensuring high-quality care at long-term care facilities, and that starts with the workforce. It starts with the dedicated doctors, the nurses' assistants that provide the daily care for millions of residents. Dr. Travers, one area where you focused your research on is the quality of care in nursing homes. It's good timing that we have you here today because the Centers for Medicare and Medicaid Services is in the midst of deliberations of a proposed rule that would require every nursing home to have a sufficient number of staff on hand to protect and care for residents. Dr. Travers, can you tell me why this rule is so important? And what impact would setting minimum staffing standards at nursing facilities have on resident care?
Sure. Thank you for that question, Senator Warren. So currently, as far as staffing goes in nursing homes, there's a dire shortage, as you know. And without sufficient staff, when thinking about the standards that are currently being proposed, that's including registered nurses 24 hours a day. A resident, if they're at night inside this nursing home and there's no an RN on site and they need medication, such as a steroid medication that only a registered nurse can administer, then that means that they might go without that medication for that night. And unless that resident themselves, or if they have a family member who will advocate for a registered nurse to be called in, they will indeed go without that medication and then could experience severe quality and health outcomes from that.
So I'm understanding you to say that minimum staffing levels are really about the quality of care, whether or not people, for example, can get the medications that their physicians have prescribed for them. Is that about right?
That's correct.
Okay. So the nursing home industry, however, has fiercely opposed this proposal, claiming that the nursing workforce is not big enough and that nursing homes could never find the staff they need to meet these requirements. Dr. Travers, you're a long-term care workforce expert. Do you think the nursing home industry argument is valid?
Several nursing homes have had to close during the pandemic because of staffing shortages, but the argument that nursing home industry is making is not valid in that we don't need staff. And I do believe that nursing homes believe that we do need staff. It's just that there's not support to be able to provide that staff. And that's where this new bill that just was introduced today comes in, as far as being able to support that staff as well. And Ms. Vogelman talked before about not making blanket mandates without the additional support. So most definitely the staff are needed. I don't think anyone would or should say that staff are not needed. And just because we can't fill those roles doesn't mean that it doesn't need to happen.
Okay, so we need the staff to provide the care, and I think part of what you're saying is we need resources to have the staff, which is another way of saying we need to pay them.
Correct.
So that they will be there. You know, the industry is missing a key element. What we've heard from nursing home staff is that low staffing is a barrier to recruitment and retention. Nobody wants to be recruited in, nobody wants to stay if the staffing is so low that it's putting enormous pressure on the staff who are there. You know, when staff are overworked, they burn out or they leave for better options. Dr. Travers, it sounds like there could be a virtuous cycle here that putting new staffing standards in place would make long-term care jobs safer, better, more attractive, and that would help with recruiting and retention at nursing homes. Does that sound about right to you?
That does sound absolutely right. Thank you.
Good. Well, thank you, Dr. Travers. Thank you, Senator Casey, for the bill you've introduced on this that would put more resources in. Also, the CMS should move quickly to finalize this proposed rule and should make it even stronger. This would help improve the quality of care for residents at the same time that it's improving conditions for the staff who provide this long-term care. Thank you.
Thank you, Senator Warren. I'll have one or two. I don't know if Senator Braun will have any more questions, or? I'm probably good to go. Okay. I'll just have one, but I wanted to follow up on what the point Senator Warren was making. Dr. Travers, I was looking at your testimony on page 2, and on the question of understaffing, which is, of course, the subject of the rule, the staffing minimum rule that we're discussing, she was discussing in her questions. You said on page 2, and I'm quoting, "Understaffing is linked to patient falls, emergency department visits, and inappropriate medication use," unquote. I think it's pretty clear we got a problem with understaffing, and I'd be the first one to say with a new policy that addresses minimum staffing, we also should provide the support that folks need to have that staff in place, and that's something where the federal government has not met its obligation for a long, long time. I wanted to ask a question about professional training and advancement. I'll direct the question both to Ms. Vogelman and Mr. Smith, who are kind of in the trenches doing this work. Both of you shared your efforts to continue your education as direct support or direct care professionals by obtaining additional degrees and certifications. Mr. Smith, in your testimony, you have received and are working towards additional credentials as a direct support professional, or DSP. You achieved, I should say, DSP 1 credentials from the National Alliance for Direct Support Professional eBadge Academy, and are now working to become a DSP 2. Why did you choose to pursue these certifications, and how has it helped you in your career?
Thank you for the question, Senator Casey. I chose to pursue DSP 1, 2, eventually 3. For myself and my colleagues, it shows that we're competent, we're capable to receive a livable wage. We're doing medications, we're assisting in all types of areas of somebody's life. So it shows that that I have the skill set and the knowledge to do the task at hand. Thank you.
Thanks very much. And Ms. Vogelman, you started your career as a CNA, and I was noting in your testimony, it sounds simple to say it, but it really gets to the heart of the work that you do, because it is very much a calling, as you said, and very much a mission. Quote, "I wanted to get to know my patients, build relationships with them, and ultimately support them in the later stages of their life." So you obviously had a passion for this work when you began as a CNA. And then you indicated you've since earned a degree to be a licensed practical nurse, or LPN, and you're working towards your registered nurse, or RN degree. So we appreciate that pursuit of excellence that you're engaged in. What do these educational opportunities help, or what impact did the pursuit of these educational opportunities have on you to help advance your career?
Thank you, Senator Casey, for this question. I believe that being able to start as a CNA helped me tremendously in being able to lay the groundwork in order to become a nurse. With my education, or my employer supporting my education, I was able to work part-time hours and receive benefits for full-time hours. So I was both able to focus on my education as well as still being able to provide for my family. I do think that the resources for our current staff should be able to be focused around this so we can continue to grow our staff that it has been drawn there for a passion. I think it's important to allow them to build those relationships with our residents and continue to grow within the career. Can you, one more time, your question again, I'm sorry.
I just wanted to get a sense of the impact on your work and your career by getting those additional educational opportunities as well as the certifications that come with it.
Okay, so I believe I answered that question, so.
Well, we appreciate it because I think in so many ways, that's a big part of the way we develop the kind of workforce that we're going to need to have the best professionals, and the fact that you're pursuing that, I think, is indicative of your commitment that you made when you were way back when you were a CNA, so we're grateful for that. I know we're out of time for questions, but I wanted to turn to my closing statement, and then I'll turn to Ranking Member Braun. As we heard today, it's past time, I would say long past time, to invest in the long-term care workforce. This investment will not only have major economic benefits, but will also improve the health and well-being of caregivers, the recipients of care, as well as their families and their communities. All of us will either require long-term care services and supports or support a loved one who needs long-term care help at some point in their lives. There's probably none of us in this room that will escape that. It's imperative that we do everything we can to recognize the value of the critical workers providing these services. The legislation I've introduced with a big number of our colleagues, the Long-Term Care Workforce Support Act, will focus on that priority. It will begin taking important steps to professionalizing and better supporting direct care workers that will in turn help recruitment and retention. As we heard from Mr. Smith today, direct care workers work long hours and often give up quality time with their family and their friends to make ends meet. We must do more to provide livable wages, adequate benefits, workplace supports, establish career advancement opportunities. We must mitigate violence and workplace injuries. We must promote a supportive and inclusive workplace culture. And finally, to incentivize providers to retain and recruit these irreplaceable professionals. Mr. Smith, Ms. Vogelman, and all the direct care workers in our country are long overdue for a workplace and a society that both values and empowers them. I look forward to working with my colleagues to address the needs of millions of Americans and their family members in need of long-term care. Turn next to Ranking Member Braun.
Thank you, Mr. Chairman. Thank you to all the witnesses for explaining your personal experiences and sharing your testimonies. I think we learned today minimally how critical it is to do something that's going to address work shortages in such a critical field. And it's not the only place. We're seeing that across our economy. I think we can also agree that we need policies that are going to be the best for accomplishing that, and that is where it gets difficult. Here, generally, it comes in a one-size-fits-all. It's maybe not just minimum requirements. A lot of times it comes with mandates without funding, and it's in the context that in the short time I've been here, 5.5 years, we increasingly don't ask employers or the people that benefit from it to do more, to get more involved. What we do is borrow money. And when you borrow from future generations, they're someday going to be older, they're going to be footing the bill on this. You want to make sure you get it done correctly. So we're at an interesting crossroads. We're borrowing now through the federal government $1 trillion every 6 months. $1 trillion is a one with a lot of zeros, and to give you the speed at which we're digging the hole deeper, it was $1 trillion annually just 5.5 years ago. So we've got 50 laboratories out there that live within the constraints of paying for it not borrowing the money to do it. So I think we got to be careful, because it's often easy to look here for the solution, because in the past, it was at least done in the framework that you don't finance it on the back of your kids and grandkids. Now, everything we do here, that happens. So I think it's important that we maybe sometimes get out of the way, give flexibility to the laboratory of states to do it, and there, it's going to be sustainable. And I think with 50 attempts at it, you'd finally find the best practices that we could all share. So I like the fact that we are focusing on it. I've just been one, when I came here, saw that as an issue. It's gotten worse. That's something we need to think about. So we did accomplish today drawing attention to an important area where we're all going to be there someday. And we got to somehow find out the best practices and marshal the efforts. And employers, in my opinion, I come from that world of being an entrepreneur, building a business. We ought to be more involved too in the things that are important to us, that benefit us along the way. I think that's where we get to the happy medium on what works. Thanks again for everyone being here. I yield back.
Thank you, Ranking Member Braun. I want to thank again all of our witnesses for your presence here today, your testimony, and contributing both the time you took to be here as well as your vast expertise on these issues. If any senators have additional questions for the record, or for the witnesses, I should say, or statements to be added, the hearing record will be kept open for 7 days until next Tuesday, April 23rd. Thank you all for participating. We are adjourned.